Gloria Lamb is a librarian retired from the Detroit Public Schools. Doctors at the DMC's Kresge Eye Institute have told her there is a problem with her eyelids.
There is something wrong with my eyelids. They have drooped so that they are halfway through the pupils of my eyes, and I'm not seeing.
You're not seeing?
Not seeing well, because when they put me on the machine to test my eyes, and they held the lids open, it's a miracle what I could see. The range of vision was so good. So I said, it is time.
It's time, says Gloria, to have eyelid surgery because even reading, one of the joys of her life, has become a chore.
I can't read like I used to. I would start a book in the evening and finish it at 4 in the morning. I can't do that anymore because it's a strain.
So the Kresge Eye Institute's Dr. Evan Black is preparing to do eyelid surgery to correct two conditions that are causing Gloria's problem. Her eyelid skin has stretched and become baggy, and her eyelid muscles have slackened.
The procedure is more about sculpting and recreating an eyelid crease than just trying to take a whole lot of skin, so that the eyelid would be able to open much easier, as her eyelid was physically droopy.
So how will this improve the quality of her life now?
Well, she should be able to see much better. She'll have better peripheral vision. It will be easier to open her eyes, easier to read, easier to drive, and she won't be straining all the time to try to open her eyes.
To begin, Dr. Black, who has done more than 12,000 of these surgeries for both functional and aesthetic purposes, actually draws with a pin on Gloria's eyelids to trace where he'll do his incisions with great care and skill.
And we mark out the patient's natural lid crease. And I prefer to use a fine tip marker for this because eyelid surgery is a very precision type of surgery.
Because Dr. Black's incisions are made in the natural folds of the eyelids, once healed, they'll be virtually unnoticeable. By the way, Gloria is under an IV sedation, but she's awake enough to respond to the doctor's request to open or close her eyes. A local anesthetic numbed her eyelids and keeps her from feeling any pain. First, Dr. Black does the blepharoplasty, which is the trimming of excess skin.
We incised the skin along the preoperative markings. We made some decisions in the office that we transferred to the patient here.
Then he repairs the slack muscles that cause ptosis, or the drooping of the eyelids.
So for the ptosis repair, I have to, and you might feel a little pinching here, okay? You can let me know. I have to actually expose the tarsal plate, which is another layer of the eyelid.
Soon, Dr. Black has finished with Gloria's right eye.
So as you'll see here, as I snug that muscle up and bring it down, we move the lights away. Okay, open your eyes for me. And you can see how that eyelid's popped way up to a normal position, and the other one's super droopy.
Wow, unbelievable.
So what we're going to do now is make that one match it.
And you're comfortable, Mrs. Lamb?
I am comfortable.
And it wasn't long before the doctor had worked his magic on Gloria's left eye as well.
Okay, open your eyes for me. And there you have it. Now both eyes are up.
Oh my God.
I can see.
Yay. So now open your eyes wide so they look even.
The whole operation took only about an hour.
Let's take a look at the patient here. How are you, Mrs. Lamb?
I feel fine.
Do you? That's great. That was a piece of cake, right?
It was. No, very little discomfort.
Wonderful. We'll have a speedy recovery. We'll call you and talk to you in a couple of weeks.
When we saw Gloria several weeks later, she was very pleased with the results.
One thing, I see better, and I look better. I see well now. I'm very happy with the surgery.
Visit us here at dmc.org to learn more about safe and painless eyelid surgery techniques, or to make an appointment with Dr. Evan Black and his fine team at the Kresge Eye Institute.
To anyone who is considering the surgery or who has been told that they need the surgery, don't hesitate. You'll feel so much better for it.
The DMC. We just think it's a better way to get better. I'm Emery King.